All right, we're talking about everything. So we're talking about everything from dozens of car windows smashed in Arlington to the controversy surrounding Kanye West.
But you see these pictures here because right now we're talking about the big story today. Concerns over a triple-demic. Doctors are warning about illnesses that they are seeing this fall that are impacting kids the most. Obviously, COVID-19 is still an issue, but the flu and RSV, they have been posing big complications and causing a whole lot of concerns for parents, with many of them saying this will impact their behaviors. All right, and let's talk about this. Tonight, we're being joined by Dr. Sarah Coombs. She's an emergency medicine physician and doctor of outreach with Children's National Hospital. Dr. Coombs, do you hear me?
I do.
Good to have you here with us tonight. Let's talk a little bit about how this is affecting emergency rooms. A lot of parents with this triple-demic, they see something, they know that it may be the flu, it may be a cold, potentially COVID-19, maybe even RSV. But what is that line? When do you say, okay, I'm taking my child into the hospital?
Yeah, so that's a great question. So we're here at Children's National in DC, and the big thing we look at as emergency care providers is your child struggling to breathe, or are they doing okay? So we know that there's many respiratory viruses out there right now, and I know it's distressing as a parent to see your child be ill with a sniffle, with a cough, with fevers. But all of those things, as long as your child is active, playful, eating and drinking, you can manage those at home. What we're really looking for in terms of bringing a child to the emergency department is, how is your child breathing? If you pull up their shirt and look beneath and look at the belly and the ribs and see if they're sucking in between the ribs, sucking in at the belly, if they're turning colors, turning bluish around the lips, that's a sign your child is struggling, and we really want to see them here in the emergency department.
So Dr. Coombs, is this something, because I think for oftentimes when you look at your child, the first thing you want to know, and that's a metric other than the sign that your child's obviously ill, is a fever. Can this happen, that what you're describing of the breathing in with the ribs, without there being a fever?
Happen without there being a fever, and that's a great distinction to make. I think a lot of people have anxiety over fever, and I and most of my colleagues would want to reassure parents or caregivers, fevers are actually the body's way of running out an illness. So don't worry about a fever per se. You can always give an over-the-counter fever reducer like acetaminophen or ibuprofen to help with the fever. But as long as your child is okay with breathing, the fever is okay. The issue is really the work of breathing, and just as you said, that can happen independent of and separate to a fever.
All right, those are good key points to see. At Children's National, the premier hospital here for pediatrics in the DMV, what are you all seeing right now? What is the primary thing and virus that you guys are taking care of as it comes to pediatrics?
We're seeing very high numbers of RSV, so that's respiratory syncytial virus. It's one of the most common wintertime cough and cold viruses, but we saw an early rise in RSV this season, earlier in the fall than we would expect, and we're seeing high numbers of it. We've had over 1,000 children so far testing positive since the summer for RSV.
All right, Dr. Coombs with Children's National Hospital, we really appreciate your expertise. Some keys there as far as fever and what you see when your child is breathing, how to distinguish in this triple-demic. We appreciate your time.
Thank you.
And of course, these illnesses, they haven't been impacting children here locally as well. In Stafford County, several schools are seeing what is being described as mass sick-outs. Our Nana-Sentuo Bonsu has been covering this. You were out in Stafford yesterday. There are two schools that right now parents are kind of raising the red flag, saying there's a lot of absences here. What's happening?
There's a lot going on. So Marina, last week, Stafford High School, they reported 1,000 people were out on Friday, and they're saying these students were out with flu-like symptoms, whether it was their stomach or runny nose, whatever the case may be. So parents are saying school should have been closed. Well, yesterday on Monday, parents from another school said these absences were through the roof. Go ahead and take a listen to what some of their concerns were, and then we'll talk about what parents think is the cause of the spread.
Let's do that.
When you look at the masses, I think, again, we're probably going to have to reassess going back to the mask, social distancing, washing their hands, everybody getting their shots, getting their boosters, and hopefully, Lord willing, we'll come through it okay.
I went to school to put some type of safety measurements in place, bring back maybe the mask for just a little bit, just to see if that died down.
And let's go over these numbers because they're staggering. Just last Friday at Stafford High School, there were 1,000 students who called out sick. Yesterday, almost 700.
Almost 700.
And now this other high school, Colonial Forge.
Yes.
There's concern, even though the school's saying that this is about the usual absence. But parents, as you can see, they are concerned.
Correct. So we got tips from parents yesterday saying you guys need to check out what's going on at Colonial Forge because the absences are just too high. So we did reach out to the school district, and they said that number was not in the 500s or 600s. It was about 250. They said this is the normal rate for a Monday during this time of the year. But parents believe, you know, there's some more going on, and they just want the school district to do more, like you just heard over there. But we will stay with the school district and keep asking them, what are these numbers? What are they looking like? And are they going down? But they're reminding parents again, like if it looks like your child has symptoms, just keep them at home so we can stop this spread, so we figure out what is causing it.
They're certainly concerned about how exactly they can mitigate that. Nana-Sentuo Bonsu, you've done a fabulous job staying on top of this story. We know you'll continue to do that. We'll check back in with you later tonight. Thank you.